I'm Dr. Sujal Mandavia, Chief Medical Officer at Carbon Health. So now you're fully vaccinated. What's next? Well, being fully vaccinated affords us freedoms that we've sorely missed during the pandemic. For example, you can now visit your family, you can visit your grandparents, you can even give them a hug. So before we talk about the guiding principles of what it means to be fully vaccinated, let's spend a little bit of time talking about relative risk. It's a concept that's often overlooked when discussing interventions, but I think it's pretty critical to understand. If we consider seatbelts, we know that seatbelts are really effective in reducing serious injury or death in the setting of a car accident. Let's take that analogy to vaccinations. What we know about vaccinations is that they're really effective in reducing the risk of serious illness or death from COVID-19, but it's not zero. So keeping that in mind, it's still important for us to be vigilant in higher risk situations. Some of those situations might be being in crowded places, being in a poorly ventilated space with others, or being out in public where we might have exposure if we're not using our measures of social distancing and masking. If you're fully vaccinated and you've been exposed to COVID-19, you can still rest assured because your risk of serious illness or death is very, very low. What we're still learning more about is the risk of transmission in that setting. Let me dig into that a little deeper. So if I've been fully immunized and I get exposed to somebody with COVID-19 and I get infected, I might still harbor the virus and transmit it. And what we're not certain about is the risk of transmitting it to somebody else and actually causing an infection. When you expose somebody else who's also fully vaccinated, their risk is so low that it's considered safe to be with that individual and not worry about measures like social distancing or masking. But if that unvaccinated individual is at high risk of serious illness or death from COVID-19, it's still really important that we maintain our strict measures of social distancing, 6 feet, and masking to reduce the risk of those around us. That's why the CDC is still recommending those measures if you are around somebody who has not been vaccinated and has high risk of illness or death from COVID-19.